awesome. Well, welcome to Planetary Health First, Mars Next. I am Michael Mann, the host, and I'm really super excited today. I have a good friend of mine, Suzy, and she's going to be coming on a little more often, a special co-host, guest host, and she's going to be joining me as well at Health. So she will be doing some cool interviews on the MedTech, all things MedTech. So, Suzy, we're looking forward to that. And we have one of your colleagues, Stan. So if you want to go ahead and take it away, Suzy.
Sure. Yeah. Thank you so much for having me. I really enjoy every episode you put out there, and I'm super excited to interview some people on the MedTech side for Planetary Health. So today, though, it's all about Stan. So Stan, it's lovely to have you here. And I know you very well, but I'm sure a lot of the people watching don't. So can you tell us a little bit about yourself and your background, and then we'll talk a little bit about the topic we're going to jump into today.
Yeah, sure. I'm happy to. Thanks for having me. So, for about the last 20 years, I've been helping suppliers in the medical industry to get contracted with group purchasing organizations, regional purchasing collaboratives, health systems. We call them IDNs, or integrated delivery networks, and helping them to get contracted there, and then helping them to create the teams and the sales structure and the clinical structure that they need to optimize those agreements. And really that's, I've essentially acted as an outsourced national accounts director for all that time. And that's what we continue to do. And under sort of one umbrella, we now offer a lot of other services too, because those companies that need our help with GPOs and IDNs also often need help with other things, whether it's building up a sales team or managing that team or fixing their internal operations or marketing, whatever it is. Our goal is to have, under one roof, all the things that they might need and offer them in an outsourced, nimble, agile, inexpensive, effective way.
That's great. And let's go all the way back to the beginning, because I'm sure there's a lot of people watching that are in the MedTech space that want to get their product on the market and have sales into the US healthcare market. So let's start by, can you just tell us, what is a GPO? What is an IDN? And why do they matter if you want to make sales in the US market?
Yeah, good question. So we use a lot of acronyms. They get a little old, but we get used to them. We throw them around pretty easily. But a GPO is a group purchasing organization. And right now in this country, there's 3 national acute care group purchasing organizations: Premier, Vizient, and Health Trust Purchasing Group. And really what they do is act as sort of a broker for their membership. And their membership will include hospitals, but also everything that falls underneath a health system, right? So it could be a physician office, it could be a wound care center, nursing home, whatever falls underneath the ownership or management of that health system. They're going to be a member of that group purchasing organization, and they're going to get access to that contracts that group purchasing organization has negotiated on their behalf. And so essentially they're going to market, the GPOs are going to market and looking for the best pricing and terms and products for their members. And they're taking all that aggregated volume to ostensibly get the best pricing possible for their members. And so we'll take suppliers and connect them and get them contracted so that they now are approved vendors nationally with group purchasing organizations. And then we help introduce them in the field to the members of those group purchasing organizations. So an example of that would be, Premier is a national group purchasing organization. One of their largest members is Common Spirit Health. And within Common Spirit, you have what used to be Dignity Health, or still is Dignity Health, and then Catholic Health Initiatives all mixed together. But they are all then able to access contracts from Premier. And so, if we go back about 5 years ago, the GPOs had really started to lose their relevance. And the health systems that we call IDNs, or integrated delivery networks, has started to do a very good job of local and regional contracting. And there were also a lot of regional purchasing coalitions or collaboratives that have formed to do more regional contracting, which makes sense, especially for services, because there's such a variation in the service that you get from, let's say, Seattle to Sioux Falls, South Dakota. There's huge differences.
Yeah. Oh, for sure.
When it comes to commodities or devices, you open a box in Seattle, it's the same thing that comes out in Sioux Falls. So a lot of these groups have started to do their own contracting regional for things that made sense. But then COVID happened. right? And so all of a sudden, it was batten down the hatches. It was, where do we find personal protective equipment? And that's pretty much all we're focused on right now, infection prevention, et cetera. And the GPOs took that as an opportunity to really retrench with their health system members. And so now you've seen the percentage of products and services that are purchased using GPO agreements in the last few years has gone up dramatically. And so what does that mean? If you're a supplier and you want to sell to a common spirit hospital, it's much more difficult now without a GPO agreement than it was 4 years ago and 5 years ago. And it's probably as difficult now to sell without a contract as it has been in my 20 plus years of doing this.
Yeah, and so that kind of leads me to my next question. When thinking about these GPOs and IDNs, how does a startup or somebody new to the market or somebody with a brand new product know if they need to engage with one? I know that when different companies are thinking about their go-to-market strategy, oftentimes the GPOs and IDNs are completely overlooked and left out. And then I'll get a call from a MedTech company saying, you know, I've called every CNO in the country because this one CNO helped us get in this one space. Why isn't this working everywhere else? And what does it mean when they ask me if I'm on contract? And so typically that's when I say, now you know you need to be part of a GPO.
Right.
However, what do you say to that? What are your thoughts on that?
Well, I think from a startup perspective, it's never too early to start that dialogue with a GPO, with an IDN, and a lot of times they'll start locally. You know, if they're headquartered in Cleveland, they might go start with a local hospital, the University Hospital Health System, Cleveland, or Bon Secours Mercy Health down in Cincinnati and Cleveland, whatever. But it's never too early to start that dialogue. The problem there is that it's not real clear where to start that conversation. So if you were just to call up Vizient, the GPO, they would say, okay, apply on our website and, look at our bid calendar. And when something comes up that's relevant, you can apply for that. Well, it could be 3 years from now before your category comes back up. And so startups can't really wait around for 3 years. So, we help them to find strategic ways to get contracted, even if it's, midterm. And what we prefer is an innovative technology, right? So if a startup comes to us and they have something that no one else has, they have something that's differentiated from the perspective of improving patient outcomes, reducing cost, improving revenue, they're things that are powerful enough to sort of move the needle. If we can go to Premier or Vizient or Health Trust and make the case that they're differentiated enough and they're unique enough and their results are powerful enough that they need to execute an innovative technology clause, they can get added to national contracts much sooner, much earlier. Now, what we run into a lot with the startups is they haven't dotted all their I's and crossed all their T's quite yet, right? So they may be waiting for FDA regulatory approval. Well, we're not going to sign an agreement with a GPO until you have that. But what we can do is sort of plan it out. And we can start having strategic conversations on behalf of suppliers with their member hospitals and IDNs while we're having that dialogue with the GPO, so that when the FDA approval's done, we don't have to start from scratch. We're ready to go out and start, and engage in that sales dialogue. So there are companies that maybe don't need a GPO agreement as much. And I would say over the last few years, what's happened with digital health is very interesting, because
That's what I was going to ask about. Yeah. Tell us more about that.
Yeah. I mean, it's, 3 or 4 years ago, none of the GPOs had any idea how to contract for this stuff. In fact, they would send out templates that were the same ones they've been using for years and years for devices and equipment. And it just didn't make sense. And so, the digital health companies that we worked with over the last few years, in many cases, they said, we don't even want to go through the process of applying for this.
Yeah.
It's a mess. And we can tell from the contract, they don't know what they're doing. That's changed. Specifically with Premier and Vizient, I haven't, I don't know exactly, I don't know for sure what's going on with Health Trust. We're working with them more on devices and equipment. But when it comes to digital health, when it comes to AI being used in healthcare, Premier and Vizient have really brought in people who understand it. They've changed their contracting processes to handle that. And people like, I probably shouldn't say names, but we've got some really good contract managers and category managers at both Premier and Vizient lately that know their stuff, and they know then how to contract for it. And then that allows for a platform for the client to go out and have, reasonable, rational conversations with the membership, because the contract is done correctly. So that's changed a lot. So really, there's no categories anymore that don't necessarily need GPO agreements. Although you could make a case that like local exterminators and grant landscapers and things, and it's because of what I said earlier, the difference between rural Michigan and, urban New York. There's so many different variables when it comes to service costs that it does make sense sometimes to do your regional and local contracting. But for everything else, you're going to need a GPO agreement.
That makes sense. So tell me a little bit. So one of the things that I feel like some people get confused about, especially if this is their first time putting a product on the market in MedTech, is they think that all of a sudden, if they get a GPO contract, that GPO becomes their distributor. So can you tell me a little bit about that, just for clarity's sake, so that anybody watching this realizes that they don't take the place of distribution channel? You still need that, but tell us a little bit more about that.
Yeah, there is some confusion there, and the GPOs in general don't do the best job of continually sort of messaging to potential suppliers or even existing suppliers about how they can help and what they can do and work with them there. But it's within the GPO framework, you've got you might. I just had a brain fart. You're going to have to.
Hopefully, this is fine. There's nothing wrong with that. So,
I got it. Distribution. Yeah. Sorry.
Distribution. Yeah.
Lost my train of thought. So people need to know, when you get a GPO contract and you're going to go sell your product to one of their members, you don't financially transact that through the GPO. You're simply referencing a contract number so that they can access that pricing. And then record that transaction so that later on you pay an administrative fee to the GPO for that, what was spent, right? So it's really just they get the contracts for you, sort of manage that pricing and everything, but they're not handling products and sending them to you. They're not, you're not, getting a purchase order from a GPO. In fact, they have their own prime vendors for distribution. So when you go sign an agreement with Premier, for instance, you'll have an opportunity to say which of their prime vendors you want to use. And there's a lot of them in different areas. You med surge, commodity, also, office and business supply. You've got Granger as a prime vendor in some cases, prime vendors for, for computer, for IT, for digital health, that sort of thing. So those are your distributors. And sometimes they will just sort of manage a transaction where it goes directly to a customer, or sometimes they will stock your product and send it in. On the digital health side, it's a little bit different. You're kind of going through what they call resellers. You got companies like E+, for instance, right?
Yeah.
Or Connection. And they're kind of a distributor too, but they may stock some computer hardware, but mostly they're just, facilitating the putting the software together for the package. But yeah, distributors, when we talk about them for most products, are companies like Cardinal and Medline and Owens and Minor, who are sort of embedded in the hospitals and the health systems and managing distribution of products in mass, like big, huge scale.
So what I'm kind of hearing is, to get a contract with the GPO, I don't necessarily have to have a ton of inventory. But once I get that contract with the GPO, I better have somebody somewhere that has my inventory that's ready to distribute it, so that when the contracts do come in, I can fulfill those contracts. So they're just that kind of that middleman contracting piece of it, which is really important because hospitals rely on these GPOs quite a bit. So would you say I have that correct?
Yeah, I think so. More and more now. And, we have clients that don't have GPO agreements yet, but we're deep in conversations with some of these distributors because maybe their product's going to go in a kit that the distributor's making, or it's something that, like, came up. We had a deal with my University of Miami where their prime vendor called and asked about one of our clients' products, and so we wound up going through them even before they got the GPO agreement.
Yep.
So it's good to have those discussions and understand, and we help clients with this all the time. Like if you're a small company, a GPOs may not be as excited to look at you because it's not enough volume yet, and maybe it doesn't make sense, and some of their members may not be talking about your product yet. But we're out there having those discussions with strategic health systems and hospitals. We're bubbling up that sort of visibility of your product to that level at that same time. And so as we're going through that process, the clients are meeting these people out there who will ultimately decide whether they get the GPO agreement. So we're kind of pulling it all together, right?
Yeah.
But it's almost like you see it sort of like juggling a bunch of balls in the air. You got distribution, you got GPO, you got sales, you got this. And what we usually will do is set it up so that a client can sort of set up their GPO agreements like dominoes, right? We don't want to get Premier, Vizient, and Health Trust all at the same time.
Yeah.
Because we want to be able to go out and optimize the agreements. We don't want to tax our resources. So if we start going through that process, we can prepare for that with clients to say, okay, we're going to launch this Vizient agreement, for example, right?
Yeah.
So where's Vizient the heaviest, and where have we had the most dialogue, and where do we think we're going to need people? And that's where we start to put resources. And we're very clear with the GPOs. Premier is an example too. We're rolling out 5 contracts right now, and we're rolling them out by region. Premier is divided into regions. And so if you're upfront about it from the beginning and you can demonstrate how you're going to roll it out, they'll be fine with you doing a regional rollout. Right. And the other thing I think I need to mention is, and I've noticed this a lot in the last 2 years, and actually I think of it a little bit as a conflict of interest, unfortunately, but you'll hear from the category managers at the national GPOs that they need growth, right? So they need you. If you're going to get a contract, this lady told me, I got to grow my category. Well, that's okay. I get it. But are we not more focused on this product is way better? It is demonstrably. We have products that are the only ones on the market that meet the new national standards, right? You think that would be a pretty good reason for them to try the product, right? So there's all kinds of different scenarios coming up out there, but it's never a dull moment, put it that way.
Well, and I think that that's a really good point too. And I think, a lot of people think, oh, I'll get a contract with the GPO and then all of a sudden the sales are going to come pouring in. And that's not necessarily what happens. And so I think a couple of things that I kind of have seen in the market, and I love your thoughts on this, is, a lot of times someone will come to me and say, I've got this great go-to-market strategy, and nowhere in there are GPOs mentioned. There's a little bit of mentioning about like how they're going to go out and maybe look for targets. But for the most part, a lot of it's focused around marketing and other things like that. But I don't see a lot in the go-to-market strategy around the GPOs. And then even beyond that, if they are in there, leveraging how to work with the GPOs is never anything that's mentioned in a lot of these documents that I see other parties providing for them. So what do you recommend? How do these, once they get a contract, how should they be leveraging those contracts? What should these, suppliers be doing?
That's a good question. And it really comes down to understanding the footprint of the GPO. And so, and all 3 of the GPOs have done a better job in the last year or 2 of creating and offering tools and working more closely together with their supplier partners so that you understand what you need to do when you get out there to optimize your agreement. But, what we do is it's based on the resources. We've got clients that as they're starting, they have an amazing product that's going to change things, but they only have the resources to sort of handle 1 or 2 or 3 hospitals rolling out at one time. And so we'll apportion that, and we'll be very strategic about that. So, we did a deal recently with Wellstar Health System down in Georgia with one of our clients, and it's going swimmingly well. Well, now we're at a point where we're just about to release the press release, and then we go to their regional GPO, Partners Cooperative, and we're getting an agreement there based on the success with one of their health systems. And from there, we're going to go do demos for all of the members of Partners Cooperative. So we've taken one small success and leveraged it within their GPO to get, that attention and visibility, get the contract, and without having to go out and put salespeople all over the country. Like the
Yeah.
old traditional route doesn't really work anymore. It works for the big companies, the Medtronics and Boston Scientifics, and got hundreds and hundreds of people and feet on the street. But for smaller suppliers coming along that may have a better mousetrap, they might not have more than 10 people in their company at the moment. So how do you break in and start, making waves and getting visibility? Luckily, we have a really good access, a really good dialogue ongoing with the people who manage these pipelines, right? All the different categories and the innovative technology, breakthrough technology at Premier. So we're able to plug clients in to these conversations pretty quickly.
Yeah.
But it's,
if you're not you, it sounds like what they need to do is either work with you or they take advantage of the resources that the GPOs have. And I think that's been a lot of a disconnect for some people. They think I'm just going to get a contract and then it's smooth sailing, the orders start pouring in, and that's just not realistic. Sorry, I
didn't want to interrupt, but to answer the last part of your last question, having to do with, startups, you've done a really good job of bringing this information to startups at a lot of the accelerators you work at. And it kind of blows my mind that we talked to these startups. They just went through an accelerator. So they got all kinds of help on their company, their product, their value prop, their pitch deck, their everything. And then when that's done, they still haven't heard of a group purchasing organization or know what an IDN is. Kind of blows my mind because it's, in my world, it's incredibly important. And once they get out there, they'll start finding that, like, if it's a clinical product, they may have an in with a physician or a CNO or somebody, and they'll go to a hospital and start having this great feedback and even do a pilot perhaps, right? The end of that process, and you get down to the buyer and they put in a purchase rec, and guess what? Well, you're not contracted with us.
Yeah.
So we have to get an exemption to buy your product, which requires that doctor to then put their name to it and expend some of their political capital to get it done. And so it's just, a lot easier and a lot better if you are plugged into the GPO and IDN route and understand how to get a contract and then leverage it and roll it out. If it's not hiring someone like me to do it, I would just say to really tap into your category managers and ask them and hold them accountable at the GPO level. Like you said it right. I mean, a lot of companies, they get that agreement and then we're going to celebrate and we're going to make millions of dollars. And then they never hear from the GPO again. You have to leverage them. You have to set up, monthly meetings with your category manager to start, and then quarterly meetings later on. And you have to say, hey, tap me into the field people. Where can I go? Depending on the product, of course, but hold them accountable. And then what tools do you have? Like Premier recently launched a bunch of online tools that allow you to set up demos with their regional teams. It allows you to send in initial targets that you can get introduced to. These are all things that we've been clamoring for years, and Premier's just started that. So I think they're hearing from suppliers. I know that they're understanding that they need to open up and expedite the pipeline of getting cool new products into caregivers' hands.
Yeah.
And so they're trying to make it easier to do that, and then make it easier to, once you get the contract, to gain that visibility and to get out there and to, get in front of people who want to use your product. And the other part that's going on now is there's a revolution taking place with AI, with medical devices, so many new things. And if we want to get them quickly into the hospital so they can be used to improve outcomes, we need to streamline that process with GPOs. So I would say to any startup that if you don't have somebody doing this, reach out to me or somebody like me. There's a few other people who do this, and at least have a meeting, kind of understand what you need. I'm not the best businessman because I give away free advice all the time, but I'm happy to meet with people and go through this stuff, because especially if it's a product, if I'm in the hospital, I want the best new product from,
Yeah.
there's no reason. We live in the United States of America in 2024, and we've been fed a steady diet of Grey's Anatomy for 25, 30 years, thinking that all the new coolest stuff is out there. And quite frankly, it's not. Hospitals are still using fax machines all the time. So it's like and so it's my soapbox, but I think we're making a lot of progress in getting new products through the GPO contract process and then into the hands of caregivers, and they're really making a difference. And it's happening a lot more smoothly and a lot more rapidly than it has in the past.
That's great. And
I'm
sorry.
sorry. I have a question. This is kind of off. Hopefully it could be helpful to those listening, but GPO, what we've been really talking about is targeting the health systems, the integrated delivery networks, but what about payers? I know this is kind of outside. Is there a GPO sort of orientation to the payers?
Not necessarily with the GPOs. They do kind of hold hands with them to a degree when it comes to pharmaceutical contracting and distribution a little more, but where you run into it would be out in the IDN. So many of them now are really locked in partnership with their payers, and you're starting to see payers even buying IDNs, and it's been somewhat successful. You look at Highmark out in Pennsylvania. If it's done the correct way, it creates a streamlined supply chain. It creates transparency and uniformity from throughout the continuum of care. And that just ultimately results in savings and also, consistent improvement in outcomes. And so you're seeing, and then you've also got, and it's a good question, Michael, because, it's not overt yet, the influence of the payers in the health systems, but it's becoming more and more overt. And so accountable care organizations 10 years ago or whatever that was, and they're still out there, but that was sort of the first attempt to bring all that together and have them work together and to make sense. And there's a lot of confusion, but there are some ACOs out there that are doing a really good job combining, working with their payers. But I think we'll see more of that. The insurance companies have so much money, it doesn't make sense for them to not start scooping up more of the health systems. And then they've got like a Kaiser situation where it's all, it's all under, it's all controlled and all self and sort of whatever the word is, but encompassed within. It makes it harder if you don't have a contract.
I guess my thought was just that it's so hard. People don't realize that there's so many, health plans in every locale, so you have to sell to each one. So anyway,
it's wild, and it's it's getting harder and harder, and so getting access to those payers as they continue to sort of either leave and move around, leaving California, for instance, right, or consolidating and trying to figure out where do we go once as they're integrating, much like trying to figure out, who am I calling on at this IDN since they've had 2 acquisitions in the last 3 years? It's the same kind of thing. What we'll see, there are certain products that come to us and we're immediately are going to go out and start having discussions with payers, right? And then for an example is using AI to augment reading, radiology, right now, radiologists will see, let's say, breast scans, for instance, right? And they're seeing such a high volume of them, and they have no real, their only incentive is to look at that breast scan for what they were looking for. There's no incentive for them to look at anything else, and there's no real mechanism in most places for them to report, hey, I found something else, right? Putting AI over that can do that. And that becomes really important to the payers for various reasons I won't get into, but we're starting to see a lot more direct approach to the payers with products like that.
Yeah. This is great. What else would you want people to know about selling in the MedTech space? I mean, you've been doing it for 20 some odd years now. I think one thing that you touched on that we didn't really elaborate on is a pilot or an IRB approved study does not necessarily equal sales. And
Right.
I think that's one really huge misconception that a lot of these companies have, is that if I can just get an IRB approved study, you might get a paper published, you might get a great partner out of it, but the people doing that IRB study are not the one making the buying decisions for the hospitals. Right. So those are the kinds of takeaways that I'm hoping the people that are watching this can get. Is there anything else you'd like to talk about before we wrap up today?
And that's a good one, Suzy. It happens all the time. We just had it happen with a client. They were in like 30 hospitals and they kept talking about how they got 30 customers. Well, those people in those hospitals had no conversation or dialogue with the actual who would be our end user customers. So they're just doing research, right? So you have to understand. It doesn't mean you can't leverage it. You can certainly leverage it. So I think that's a good point. I guess what I would say is I'm encouraged because my whole career has been bringing new technologies to add friction to categories where I think it's needed. I don't think that we are well served by having any one company control a huge category. And you could look and see what happens when they do that, right? The prices ultimately wind up overall. The cost of the hospital often goes up, even though individual prices of products might, be a little lower. They start to bundle and they start to add things and they start to put little caveats on, well, if you stop using that, your price on this will go up. I don't like to see that. And so I am encouraged, though, with all the new technology that we've seen, with all the startups that we see. I mean, MedTech Innovator that we work with, they saw 2,000 applications last year for new from startups. And they wound up selecting and narrowing it down to about 65 to go through their cohort. But just the fact that, and I think that 2,000 represented about 28% of the total number of startups out there in the MedTech world. That's staggering, right? That's a lot of stuff. And some of the stuff we're seeing is groundbreaking. So I'm encouraged and I'm really happy about working with people like Ross Cleveland and Karen Niven at Premier, Olya Carter and her team at Vizient, and Janelle Lingle at HPG, who understand, that we need to take a look at these new things and get them in the hands of our caregivers, even if they don't have a ton of business within your membership yet. It's more about doing the right thing for the patients and the caregivers. And that's what I like about doing what we do is I can get up in the morning and feel like, my life mission is aligned with my work mission, right? If I were selling cigarettes or soda or something, it wouldn't feel quite that good about it. But knowing that if we succeed, like with one of our clients, we were able to reduce ICU alarms at a very busy ICU in Georgia by 90%. And so we've created like a really quiet, calm environment in an ICU. It's never been done before. These are the kind of things that just make my heart feel good,
Yeah.
So it's a good.
If you've ever had a loved one in an ICU, you know how bad it really is. Or if you've ever had the misfortune of working in one every day and going to bed at night and you're dreaming about alarms going off. So I appreciate that. That's a great way to wrap things up.
Yeah. No, thank you guys so much. I think I just wanted, I want to make sure to get the word out there for these companies so that they don't spend 2-3 years toiling, knocking on doors, trying to get into hospitals and without having that, that approved vendor status. At the very least, take a look and see what opportunities are out there and see how you can apply for them and try to get contracted. And then again, utilize the tools that the GPOs and even regional purchasing groups are creating for you to optimize once you get the agreement. That's really the key.
Makes sense.
Stan, you're the man.
You're the Michael man.
Exactly. This has been awesome. I really appreciate you coming on, Stan, and really helping us, our audience, understand GPOs, what they are, how they can help, really startups as well. And you too, Suzy. Love having you on. Look forward to having you on more.
Yeah, absolutely. Happy to be here anytime.
It's been great. I appreciate both of you. Thanks so much.
All right. Until next time, friends.